Joined us last week. We were having a conversation with someone who was representing the best interests of the farm workers, and he was concerned about their working conditions, the proximity of even where there's the dormitories where they were sleeping. Doing, he said it was too close, and he wasn't sure what was in place for them. Well, here we are. 17 Jamaicans are among 47 workers employed to Green Hill Produce in Chatham, Kent, Canada, who have contracted the coronavirus disease, and they've been placed in isolation. 45 of the positive cases are migrant workers. 2 are members of staff from the community located in rural Ontario. This not look good at all.
It's not terrible though, because Colette Roberts Risden, the permanent secretary in Jamaica's Labour Ministry, told the Gleaner that her office has been in constant touch with the Green Hill, the affected workers, and the relevant Canadian authorities regarding the welfare of the Jamaicans. And she said, based on our last report, 17 Jamaicans are now in isolation after testing positive for the virus, but none of our Jamaican workers are seriously ill. They have either mild or no symptoms at all. However, we know the coronavirus is very dynamic, so things can change. So it's not bleak, it's not...
Yeah. Also good is that Green Hill has given the assurance that the affected workers will continue to be paid 40 hours per week, and they're going to be supported with medication and other supplies during their recuperation. That was one of the concerns that the advocates had on their behalf, that if they happen to contract corona, what would happen? Would they still be paid? What would be the health response? So at least that's good.
And I'm glad they addressed the being paid part, but people are still concerned about their contracts. Like, how will it affect their contract? Because here, Syed Hussain, Executive Director of Canadian-based advocacy group Migrant Workers Alliance for Change, spoke to the Gleaner and said that seasonal labourers contracted to work in Canada should not have to decide between their safety and earning in a foreign country.
Mega said that easy for saying aside.
Yeah, it is.
Mega said that easy for saying. We spoke to him last week, and his belief was that because the workers signed a document before they left to say that we understand the risk.
Because they had left in January.
Yeah. No, they left in March. Some left in March.
Some left in March, but there are some who left in January as well.
But those who left after, they were saying, we understand the risk, but we're willing to take it. And we will bear the risk. So they had kind of absorbed the liability from the government. He was saying that they should not have been made to sign it. But if the government say, if you're going out, brother, this is on you, and you say, well, I'll take the risk. That's how risks go. The most we can do is if something happens now, which they have, is reach out to the people to make sure that you're okay. So we'll see.
All right, so the second hot topic is tie it up. Garbage collectors urge stricter disposal methods. They've been moaned useless coveralls in St. Catherine quarantine. And the article starts by saying they suffer the same fears as those in the communities they visit and risk infection like any other member of the essential services. Yet, garbage collectors are the unsung warriors of Jamaica's COVID-19 fight. The sentiment echoed among collectors in Portmore, St. Catherine, who, despite the confirmation of more than 137 positive cases at the time, stemming from the municipality, valiantly cleaned the area last week.
I'm going to side with them. I'm going to tell you why I'm going to side with them. St. Catherine people talk truth. Well, I can't speak for Portmore. They have been like clockwork coming into the community, curfew or no curfew, lockdown or no lockdown, making sure that the things have been collected. If we say COVID stays on surfaces, then they can touch something.
No, man, they're out there.
They can touch something.
They are on the front line,
I remember
literally.
Some people come from supermarket and they say, oh, I don't want to catch COVID. So they take the thing off at the door and throw it in the garbage.
Yeah.
So we have to do better than that, Mr. Solid Waste. We have to do better than that.
Yeah, and I think we need to, again, keep looking out for each other. So when we're disposing of our garbage, be mindful not to leave the bags open. So when them come and then put the stuff in the truck, that things won't spill and things won't all over the, because
Well, my garbage man, them if it open at the garbage bin, them I take up the bag, them I look at you. You better go back out there go pick up the things. Which is fine, I can't blame them, because if they have to stop at every house and clean every house, it's too much. So yeah, protect them. It's true. It's true. They need better. They need better. They need
yeah,
better.
but this says since the first positive case of COVID-19, the NSWMA said it has collected close to 82 tons of garbage island-wide. Our teams have received training on correct ways to don and remove hazmat suits, guidelines to be observed upon entering quarantine areas, and how to launder garments worn in quarantine areas.
Yeah. So here are some tips. We're going to the news. They say secure the household garbage by properly bagging, tying, and placing in a container. Now let's leave it on the side of the road and then know it's a hungry dog live on the avenue. Double the garbage bags containing tissue, gloves, face masks, and diapers, and place storage receptacles at the front of the premises where it can be accessed without hindrance 24 hours per day. 2.5 billion of the 2.8 COVID-19 budget has already been spent. So,
I guess we
I
can.
forgot to do something doing.